Thank you. All right, and we are going to keep on the line of safety and access, and we're not going to go through tons of this, but basic first aid, really important to know, especially when mobility is an issue and time is of the essence. So how many people have a first aid or CPR course that they've taken that they're current in? Okay, highly recommended. That's something that you take. There are a lot of places that you can get it that are inexpensive. If you have a question about that, contact me. I'm happy to put you in touch with places that you can do it fairly cheaply. In fact, if you all turn around and Chip raises his hand, he's certified and he'll hook you up. So make sure that you reach out to get that information. Oh, sorry, now I'm not good with this. So again, all of those things are in place. First aid kits. I think it's really important that according to what you certainly have going on, that you've got something in your car, at the office if you're still working, or at home. That might mean extra medication. That might mean certain types of extra pieces or devices for equipment. It really isn't that big of a deal to put a few things into a backpack, throw it in your trunk, and just leave it there. It just, so you know it's there if you need it. It does not have to think of as the first aid kit with the big red cross on it. We don't have to take it that way. I actually have a client who has a bin because she's on a lot of different medications and has a lot of health issues. So she has a bin that she keeps everything in a closet. And then when she goes to travel, her family grabs that little Target bin, throws it in the car, and they don't ever have to worry about anything. It really is about peace of mind and making sure that you're ready at a moment's notice when something happens, because you really don't have time. Speaking of time and moment's notice, I'm going to bring Ruth Ann up, and Ruth Ann is going to talk to us about being able to have some accessibility when we have emergencies that come in. So Ruth Ann, if you want to take it over here, I'll give you your clicker, and it's this button to the right. So.
Like she said, I'm Ruth Ann Arbor with Phillips Lifeline. I'm just going to talk general about personal emergency response services or systems. But one of the things that currently right now sets Phillips apart is we do have a button now that if you would have a fall or are not able to push the button, that it'll automatically send a signal in. And when you have time, come by our booth and I can explain a little bit more exactly how that works. But some of the things you definitely want to look at when you're looking at a personal emergency response service is to make sure that there is no long-term contract. There are some companies out there that require a 3-year long-term contract. You definitely want to be able to just have it month to month. And that the equipment is regulated by the FDA. It just puts more control over the equipment and the quality that you're getting as far as the product. Does the company manufacture its own equipment? Again, that's important so that they have control over the product as well. And then that the calls are recorded and archived for just if you have to go back if you didn't feel that your call was answered appropriately. But the biggest thing about a medical alert service is it keeps you safe and independent in your home. Nobody ever plans their falls, nobody ever plans their medical emergency, and oftentimes you're not walking around your home or having your either cell phone and or landline telephone right on you all the time. So the biggest thing is it can get you help right away. The nice thing about our service as well is you can get the adaptive devices. Our equipment is all adaptive, accessible, so you can get a sip and puff, a rocker switch, a toggle switch, or even have a P switch, so that if you get to a point where you're not actually able to use the regular type of button, you can get that adaptive equipment set up through the service as well. You can actually program more than one adaptive, so let's say you have one on your wheelchair as well as maybe one at night by your bed. So, and I can answer questions at my booth later as well. And I'll segue into, I have a raffle that we're going to give away.
Grab the box here. Who's feeling lucky?
Lucky.
All right, nice.
All right. Let's see. Shelly Rager.
Yay, Shelly. Come on up. Sorry, that Yeah. Sorry, with one hand, this isn't as easy as it looks. Congratulations.
Congratulations. It's a gift card to Panera.
Great. All right, anybody have any questions for Ruth Ann before we move on to the next set?
And I'll be at the booth too. I can answer any other questions that you might have.
Perfect. Thank you so much. Try not to make that scream at me. All right. So we're going to talk about documenting and recording care, and how many people go into the doctor's office and they get there and you have no idea what you were going to talk to them about when you get there. They maybe asked you to take care of some vital sign recording or some responses to how medication is working. It's very difficult sometimes to make sure that we go in and we're prepared as much as we should be. So this was actually taken from the American Red Cross. And so I'm not going to read this to you because you can go back and do that. We're going to highlight more on the actual pieces. But one of the things that they recommend, and we're going to use a little goodie out of our toolkit, is making sure that you take them the same time each day if you're doing vital signs. Because if you have someone laying in bed and you do vital signs, and then 2 minutes later you set them up, are those vital signs going to be the same? No, we really haven't changed anything, but they're not going to be the same. Or how about vital signs in the morning when we have more energy in comparison to vital signs toward the end of the day? Very different. So you want to make sure that you're documenting around the same time and in the same position. There's a difference between lying, sitting, and standing, so just for consistency. So everybody grab your toolkit. There's a couple cool things in there that I want to show you. And it might actually be in your book, now that I think about it. Thank you, yeah. Inside the book, you've got a little, You've got a little bag with a great highlighter, by the way. Leslie and I were playing with this the other day. It is my favorite highlighter now. It is super bright and bold, so you've got that piece and a pin. And we've got another donation for this, which is really cool. It's a Post-it pocket, and it's got little stickies on the back. And so if you have really important medical information, maybe you're leaving and you have a caregiver or a friend coming in to do something, you can stick this up on any surface with these little tabs and stick whatever you need in it. Or let's say you've got something you need to remember to take with you to the doctor or to take with you when you leave. Stick it by the door. It's right in front of your face. It's kind of a cool little piece. So that's in there. I'm going to skip to make up some time on some of this. Questions that you should ask on medication. You really want to ask a couple things I want to highlight. How about, do you ask if you can crush meds before you do it? Really important. Not all meds can be crushed. Some meds can be liquid, some can't. Really important that you ask your doctor to make sure if they can. Also, what that dose? What happens if we do double dose? And do you know the side effects of some of the medications? And what we never ask is, how should I stop taking that medication? We never think about that, right? We go, well, that med isn't working. It was supposed to aid in maybe an anti-nausea. And so we just go, well, it's not working, we just stop. Some medications are built up into our system, and we can actually have some physical symptoms when we cut cold turkey. Diarrhea, we might have some dehydration from that. We might have nausea, headaches. I don't really want to add those things to my plate. I don't know about anybody else. But make sure before you stop, you ask your doctor what's the best thing to do and how to go off that medication. Along with your healthcare provider too, pharmacies are great. They will help you if you can't get a hold of your doctor to call any pharmacist and ask them about that. That's what they're there for. So keep those handy. The other thing about documentation, if you want to pull out of your little toolkit, is this wonderful little blue flash drive. How many people have thought about keeping your medical information on a flash drive, including your questions to ask your doctor and your notes, and taking this with you, and telling your doctor, plug it in, all my questions are there, and guess what your doctor gets to do? Type back out all of your answers and any instructions, and you come home and you plug that in. How handy is that? You're not taking big notebooks, you've got everything that you need, and you can have multiples of these, and so you can have one in the car in case of an emergency, you can have one in your purse. If you go to the hospital for a quick emergency, you've got it right there. And this is a keychain, so you can even keep it on your keychain. You don't have to put personal information, right? We don't have to expose ourselves. So there's privacy. We don't have to, yes, it's in that little, I'm sorry, I took mine out. It's in a little white tube in your kit. But you don't have to put your name and your social security number on there. So if you lost it and anyone found it, wouldn't necessarily have anything, but wouldn't it be great to have all of your information stored in one spot so that you have it handy?
Does that need to be in any standardized format or doesn't?
No, most now, I mean, electronic data is so commonly stored and sent medically. We are going to get to the point, and it's something now with a lot of it, it's probably more information than you need, but ACOs and somehow the healthcare system is changing with Medicare and Medicaid, that we are going to get to an electronic transfer for if you have a cardiologist and then maybe you have a regular doctor, so that everybody can see all that medical information, because the coordination of care, as we know in our system, is falling apart. But until then, honestly, this is your coordination of care right there that every doctor can have, and every doctor can type in it and see what the other doctor wrote. You can even say, put your notes in here so that I can take it to my next neurology appointment and they can read it. So it really is, you're kind of taking the next step that the healthcare system is going to take ahead of time. Great question. He asked, by the way, I said I was going to repeat it and I totally forgot to do that. If it has to be on any special format, and it should be fine on the zip drive like that. My brother is a doctor, and I asked him a question. I said, what I hear all the time is people get upset because you only have so much energy for the day. Is that correct? You go to the doctor, you're exhausted by the time that you park, you get into the doctor appointment, and then you sit in the lobby. Did they get you right on time? Never. And it's frustrating. By the time that you get in, you're frustrated anyway. They have this much time for you, so you don't feel like you're listened to. You leave. You don't feel like you got what you need. And so I said, tell me what you think your patient should know. And I thought this was so important for us to pay attention to. So if you want to avoid wait time, you want to be the first appointment in the morning or the first appointment after lunch. The reason is that they normally keep an extra long lunch hour, and that's where they make up their downtime. Does that make sense? If they're falling behind, all of a sudden they don't have an hour and a half for lunch, they have 20 minutes. They always start, usually, but they try, their after lunch appointment to be just like the first appointment of the day on time so that they can end on time. So get one of those appointments. They also recommend that even though you would have all your information on a flash drive, bring all of your medication in their original containers so that they can see dosage and different things that they might want to see. They can call the pharmacy that issued it directly. So that was their recommendation versus a list. And then appointments are set up to really address only one or two medical issues at a time. And what we come in is or I do anyway, because I only want to go to the doctor like once a year. So I come in with this laundry list of things I want them to fix. They're not set up that way. They don't have time. And so if you have more than one or two issues, you need to schedule a back-to-back appointment. That way they have more time to see you. You're going to cut down on your fatigue and your energy of having to go back and forth, and you're going to get the answers to the questions that you need. The other thing too is that sometimes we turn doctor's appointments into social visits. And that's not meant to say anything bad, but we talk about, well, how are you? How you been doing since the last time I saw you? Oh, well, great. You know, Aunt Jenny broke her leg, and Cousin Bob came in, and he got a new tractor, and 20 minutes later, we're on to why we're there. He has 30 minutes for an appointment. How much time do you have now? 10 minutes to tell him your problem, get a diagnosis, and have him help you. It's not enough time. So you really want to make sure, not that you're not being cordial and your doctor isn't being cordial, but take that time and probably would make 2 back-to-back appointments. Again, we talk about fatigue. How many people have experienced the fatigue? It's bad, isn't it? How I explain it, for those that don't understand, honestly, is that it's like a cup full of water. And when that cup is empty, it is empty. Can you take a nap and get it back? Take a half an hour nap, do you get all that energy back? It's gone. It's gone until the next day or the day after. It doesn't build up the same in our system that it does in someone who doesn't have ALS. And so we forget that going to the doctor, that's it. That's a day activity. You can't schedule lunch with a friend, going to the doctor, and another activity in the evening and expect that the next day you're going to get up and be able to perform the same way. You're going to have to change how you structure your life and how you organize your activities. And here's a word we're all going to say together. Ready? It's just 2 little letters. What do you think it is? Starts with an N. No. Why do we have a hard time saying that? No. Can you do this today? Can you squeeze me in? No. No, you only have what's in that cup. When it is gone, it is gone. And so again, when we talked about priorities and goal setting, if you haven't done that, then how do you know what you want to use that glass of water on? Where is that energy going to go? And do you want to waste it sitting in the lobby in a doctor's office? Do you want to waste it going to your insurance company or to a banker? You need to tell them, when I come in, I expect my appointment starts on time. There is nothing wrong with saying that. You can schedule my appointment whenever it works for you, as long as when I come in, it starts on time. If you can't accommodate me, then I need to take my business somewhere else. Right? That's pretty easy. 2 minutes later, you walk up to the counter and said, we have an agreement. What happened? Smile pretty. So that means you're going to take me now. Nothing wrong with being assertive. Everyday shortcuts we need to take, and we're going to talk about this a little bit when we get into fundamentals of care. You need to prioritize. Again, making your decisions on what's important, what do you want energy for, and what doesn't matter. Does laundry matter right now? Nope. If the grass is a mile long, does it matter? Nope. You got to prioritize. Organize your workstations. Do you have everything in the kitchen or in the bathroom or anything that you need? I honestly was like a 90-year-old woman because I had my recliner, no this arm, I had my table over here, and if my son touched anything that was on my table that I needed, I would just completely go ballistic. I couldn't get up, and I couldn't do anything. I had a tube in my neck, I was stuck. So everything was right here at the reach of my hand. If it wasn't there, can you imagine how much energy and time I'd spend running back and forth trying to get things? You can't do that. You got to prioritize your workstation. Plan your day. We talked about that. Avoid rushing. What happens when we rush? More fatigue and accidents happen. We fall. We're going to fall. We're going to get hurt. And what happens when you rush and you're kind of all of a sudden your attitude does what? It does. You're rushing me. Give me a minute. What happens to our independence when we need just those 2 minutes extra to do it for ourselves? It's gone. So if you need an hour and a half in the morning to get ready, you need an hour and a half in the morning to get ready. And if you're going to be late, guess what? You're going to be late. It's okay. But you've got to be able to plan that. Avoid unnecessary motion. We heard Nathan and Amy talking about avoiding transfers, right? I think sometimes we have a lot of pride, and so in certain positions we say, well, I need to go to the bathroom, but I'm just going to go all the way across the home instead of use a urinal. Who cares? Why do you want to do all that energy when you can just use a urinal? Now we have people who do the opposite, and you don't want to use the energy to go to the bathroom, so what do you do about drinking? We stop drinking so we don't have to go to the bathroom. That's really bad. Combine activities. Can you be sitting on the toilet and brushing your teeth at the same time? Sure. Why not? Lots of things we can do at the same time, right? No one needs to know you're on the potty. It's all right. So we're going to go into personal care, and we're going to have a lot of interaction in this section. So, under personal care, we got a little nice donation from United Seating, which is really cool. So you have a little lip balm, and the cool thing about this is it's 15 SPF. So really important as our skin changes to use that. So make sure you keep that in your pocket because that's going to be a change that we have. So real quick, we're going to start with everybody's on the same page. Safety, privacy, dignity, communication, independence, and infection control. Safety we covered. Privacy. Do we forget sometimes that personal things really should be kept somewhat personal? Are we bathing someone or getting someone dressed and the windows are open and our neighbor Bob's mowing the lawn and we're like, hey Bob, how you doing? And our partner's standing there totally exposed going, hi Bob, nice to see ya. We want to keep some dignity and some privacy. Make sure curtains are pulled. Make sure that if someone doesn't want the kids seeing them laying out getting bathing, that's private. We go in another room. Now some people don't have those boundaries, no problem. But if you do, make sure that you're respecting them. We're going to talk a lot about communication. Before you do something, you have to communicate with somebody. You can't assume that they know what you're going to do, and you can't assume that they know what you're going to do. If you go to grab somebody and they move you wrong, what is the first thing that you're going to do if it starts to hurt? You're going to pull back, or you're going to cringe, You're going to hurt the person trying to do something, especially in transfers. I think you guys were my guinea pigs in the last symposium. We were doing some transfers and about how important communication is. It's really important that you know what you're doing. And that goes to everything, not just transfers. And then infection control, we covered that earlier. So we're going to go into different grooming pieces. And you're actually going to get to participate in most of these. So we're going to talk about mouth care. And guess what I have for everybody in our mouth care section? I can't hold that arm up very high, so. Toothpaste, toothbrush. I want you to pull those out, and I want you to get a partner, because we're going to practice, but you don't have to use the toothpaste. So you're going to have to get your toothbrush out, and you're going to have to pull it out of the plastic, and I need a guinea pig to come up here and help me. Can I have a volunteer? Perfect, come on up. So we're going to talk about brushing, and I want you to brush someone next to you's teeth, and I want them to brush yours, because the reality is, have you ever had your teeth brushed by someone else? It feels a little funny, but we're going to practice it. So the biggest thing is we're going to talk about how to touch someone, how to communicate. I'm going to put my hand on your face so that she knows what I'm coming at. Now if I just, and again I'm not going to be able to lift my arm real high, but if I was just going to go at this like her, what would you do if I just went at your face like that? You're going to back up, especially if you've got some aspiration going on and some choking. What am I going to automatically have happen? Because you're going to choke and you're going to go back. So you're going to want to take it, and the reason that I want you to do this is I want you to feel pressure from someone else, to feel what it feels like. Although this is just a toothbrush, and I don't have to keep my hand on your face. You can tell I don't have boundary issues with touch. But good. Before you go in and do that, this is no different than shaving. Whether you're shaving a woman's legs or a husband's face, whether you're putting lotion on, whether you're shampooing, no matter what you're doing, this is a great example of how to feel your pressure. So what you want to do is ask your neighbor or your friend to open up their mouth, and you're going to gently go in, and you can start on the top, gently, my arm is really sore, and you want to work in circular motions like this, around, and then what I'm going to do is stop and say, how was that? Too hard, not hard enough? It was just okay? What can I do better? Go under the cheek. All right, so we're going to go underneath the cheek. I'm going to be a little rougher. And we're going to go in just circular motions. How's that? Too hard, not hard enough? Perfect. So I want you to practice that and try that. And then we're going to talk about a few things while you're practicing. So I'm going to give you that one, because I'm not going to use that later. Not that you have any problem. But thank you for coming up. And you get to enjoy my favorite cookbook from one of our favorite ladies, Meryl Beth. Her family wrote a cookbook for her. So practice while I talk. I want to see everybody practice, or I'm going to call you out. I'm going to come down there. I'm not afraid. So I want to see toothbrushes out. I want to see that. A lot of times when you're doing mouth care, we forget about the things that generally happen with that, where we can have dry mouth or we can have drooling. There are certain over-the-counter things and medications that can help. So in here talks about that if you're drooling, you can not only have some issues with embarrassment, but it can actually cause some skin breakdown by constantly having saliva on your face. Yes? So she's asking what if they're using an electric toothbrush. Same principles apply, because the pressure that you're applying with the electric toothbrush might be too hard. The other thing with the electric toothbrush that helps is that usually it does all the work for you, so you can just hold it. And if you're using electric, that increases someone's independence longer, because they can hold it, they don't have to do this motion. They can just hold the toothbrush. Does that make sense? But you can also use it to help them if it's reaching in areas that are difficult. So think about what saliva is. What does saliva do to our food? It breaks it down. So if you're drooling and that's constantly on your face, what's going to happen to your skin right in this area? It's going to break down your skin. It's the same thing. So you want to make sure that you can avoid that if possible. So again, there are some over-the-counter things, but there are some medications that can help. Now those have side effects, so you need to again talk to your doctor about what those do. Same thing with dry mouth. Does anyone experience dry mouth? We're all big one happy family, so we can throw it in there. If you do, there are medications that can help. But as well as that, even things like sponges. Does anyone know what those are? The little sponges that help? No, you can just kind of keep those handy. They're great. They just moisten a little bit. We use them a lot with hospice patients. The issue is just that it moistens our mouth without constantly having to drink. Because maybe you're drinking and drinking and drinking and you just want moisture, but you don't want to keep drinking. Now, I'm not saying don't stay hydrated, by the way. But those are great. The other trick about those, if you throw them in your freezer, They actually will help with dry mouth so much better because it's just a cold sensation feels better than just neutral moisture. There's non-invasive, you can use humidifiers as well, just to kind of moisten the air. There's dry mouth sprays, there's moisturizing mouthwash. Again, try over-the-counter things. If they don't work, contact your doctor. So, who tried the toothbrush? Did you learn something? What'd you learn? Exactly. Perfectly. She said it helps to know what feels good and what doesn't, and that even if someone isn't verbalizing, they're shaking their head yes or no. It really helps, and if you can do this now, when you have more motor control, the other thing that you can do that I see over here is we've got 2 hands on 1 toothbrush. That's fantastic. That's called hand over hand, and what that does is allow you, while your partner is actually showing you how they like to brush their teeth normally, your hand is on it so you can feel their motion and their pressure. It's a great way to learn how to do anything on another person's body by hand over hand. If you do that while they have mobility, guess what you're in line to do when mobility is gone? You've already got that experience, right? You're already set up, you're already in alignment. Let's talk about shaving. How many people have shaved another person's face? How fun is that? The first time you got him with a razor. So we're not going to necessarily talk about how to do all those hands-on. I mean, we are. But what we got were some tips for some men. Because do we shave our legs the same way men shave their face? How do we shave our legs? What direction?